Hi Rahul, thanks for coming in here today. Dr. Smith made a referral earlier and had some concerns. Do you know why you're here?
Yes, I was at Dr. Smith's office last week and he mentioned to me about my triglyceride scores being so high, and that's the reason I'm here.
Okay. We typically tend to ask all our patients some intake questions, to help us get to know them a little better. Would you mind if I ask you a couple of questions today? It is a part of our comprehensive treatment protocols.
Sure, that's not a problem.
Okay. And I would recommend that you be completely honest because that would really help me in understanding your needs so that we can go move forward accordingly. All right?
Sure.
Okay. How often do you drink alcohol?
Almost every day.
Okay. And what's the amount of alcohol that you typically tend to drink?
Well, after coming home from work, I have 2 to 4 beers
Mm-hmm.
just to relax myself.
Mm-hmm. And in the past year, have you used or experimented with any sort of illegal drugs or prescription drugs for non-medical reasons?
No,
Okay. Do you currently smoke or use, any form of tobacco?
no.
Okay. Would you mind if we talked for a few more minutes about your alcohol use?
Sure, that's
Okay.
fine.
I have this screening tool right here, okay? So I'll be asking you some questions
Okay.
from this. Um, on average, what's the maximum number of drinks you had on a given occasion in the last month?
Well, I think it was a couple of weeks ago when I was at my friend's house
Mm-hmm.
and he was having a party and I had 6 beers
Mm-hmm.
and a mixed drink.
Okay. And have you felt like you ought to cut down on your drinking?
Well, I don't think so.
Mm-hmm. Have people annoyed you by criticizing your drinking?
My wife used to nag about my drinking habits,
Mm-hmm.
and we are separated now.
Okay. When did that happen?
Few months ago,
Okay.
6 months ago.
And have you ever felt guilty about your drinking?
Not really. Maybe while I was in college, I felt guilty about it. Not anymore.
Okay. Have you ever had a drink or used any sort of illicit substances first thing in the morning after waking up?
No.
No. Not even to kind of steady your nerves or to
Maybe
get rid
while
of.
I was in college. Not anymore. I don't.
Okay. Um. Okay. Would it be all right if we can talk a little bit about your drinking and if I may explore some information about your drinking?
Sure.
Okay. We know that drinking above a certain level can cause problems such as heart disease or diabetes or depression or insomnia, etc. Based on the information that you provided in here, your drinking puts you in a higher risk for many health and emotional concerns than those who drink at lower ranges. Do you see any connection between your alcohol use and your increased triglyceride levels as such?
Well, yeah, kind of.
Okay, can you tell me a little more about that? Like, where does that leave you?
Well, when I was at Dr. Smith's office last week, he mentioned that I should cut down or else I'll end up having diabetes.
Okay, so you're saying that there are consequences to your drinking?
Yes, I need to control it.
Mm-hmm. What do you think you can do better to control your drinking?
Maybe cutting back some or adding some exercise to my routine.
Mm-hmm. Sure, that sounds great. And according to the US guidelines, um, low risk drinking for women and adults above the age of 65 is about one drink per day, which up to seven drinks a week. And for men, it is no more than two drinks a day, and or around 14 drinks per week. So, based on your current health concerns, your plan to cut down and to add exercise to your routine along with some dietary changes may be pretty good. Would you like me to send you some more information on healthy drinking patterns?
Sure, that would be great.
I have a booklet. It's called Tips for Cutting Down on Drinking, and some more resources that I can email you shortly. Would that be all right?
Yeah, thanks.
Okay. So, to summarize, can you tell me what are some of the steps you agreed on today?
Well, the first thing is that I need to cut down on my drinking, maybe drink one or two beers a day,
Mm-hmm.
add some exercise to my routine,
Mm-hmm.
maybe exercise twice a week,
Mm-hmm.
and eating healthier,
Mm-hmm.
like green vegetables, add more proteins to my diet,
Mm-hmm.
have juices,
Mm-hmm.
add water instead of sodas,
Mm-hmm.
as Dr. Smith had mentioned. I think that will be a good choice
Sure.
to begin with.
Yeah.
And obviously, cutting back on the drinking, that's the first priority for me in my life.
Mm-hmm. Do you think that would work out for you?
I think the changes, if I make some small changes,
Mm-hmm.
as Dr. Smith mentioned, as you mentioned, I
Mm-hmm.
think that would work just fine for right now, and I
Mm-hmm.
can making bigger changes later on.
Mm-hmm. So tell me on a scale of 1 through 10, 1 being you're not at all ready, and 10 being you're completely ready to make some changes in your life. Where do you see yourself at this point as of now? And consider your drinking as you're um, making that choice.
Well, I think I'm 10,
Mm-hmm.
especially you gave some good information, and Dr. Smith also mentioned to me about the consequences of drinking. I
Mm-hmm.
think I'm 10 at this point.
Mm-hmm. Well, I'm just curious, what made you choose a 10 and not a lower number at this point?
Well, making the small changes and the big impact it will have on my lifestyle, I
Mm-hmm.
think
Mm-hmm.
I'm ready to make that change.
Okay. Do you envision any sort of barriers or problems in making this change in your drinking habit?
Well, not really.
Mm-hmm.
Especially maybe, except maybe on the weekends.
Mm-hmm.
When
Mm-hmm.
I go to my friend's place and if they are drinking, I might get back into that thing.
Mm-hmm.
But I need to control myself.
Mm-hmm. How will you handle that when you go over the weekend? Like, what's your plan of action gonna be? How are you gonna deal with it?
Well, I don't know right now, but I think it's a self-control,
Mm-hmm.
and I think I'll get through it.
Mm-hmm. Um, I would also encourage you to consider getting some additional help for dealing with issues related to alcohol. And you had mentioned earlier about the separation that you have with your wife. How are things going now between you and her?
Things are going okay in my life.
Mm-hmm. Well, I would like to put you in touch with a provider who kind of specializes in this and might be able to help you out with your wife as well. What do you think about this?
Well, I think that would be wonderful.
Mm-hmm. Great. I'll get you the number and the brochure to the provider, and it will be according to your health insurance. So we can we can get through that. Okay.
Sure, that would be great.
Sure. So I'll follow up with you on your monthly checkup then next month. All
Okay.
right, and you can give me some feedback on your experience and what's been going on. Um, so thank you for coming in. You have a lovely day.
Thank you.